There was a time you go to medical school, you come out of medical school and you hang a shingle up and you say, hey, everybody, I'm an OBGYN. Now those days are gone.
Welcome to the Business of Healthcare podcast. From the Center for Healthcare Leadership and Management at the University of Texas at Dallas, Naveen Jindal School of Management. Here at UT Dallas, we bring together business heads and other thought leaders to help navigate the challenges of our rapidly changing, increasingly complex healthcare ecosystem. I'm your host, Professor Dan Karnuta, Director of the UT Dallas Professional Program in Healthcare Management. Be sure to subscribe on Apple Podcasts, Spotify, or your favorite podcasting app to ensure you don't miss any future episodes. You can also join us online at businessofhealthcarepodcast.com. Today, we'll be returning to the roots of the Business of Healthcare podcast, namely the business of healthcare. And I emphasize business. At the University of Texas at Dallas's Naveen Jindal School of Management, our healthcare management curriculum focuses on preparing students for the dynamic business environment that exists in the U.S. healthcare market. The U.S. healthcare system has developed over time into one that is unique in the world. Our system features a provider segment that is dominated by private ownership, both for-profit and not-for-profit. Although certain provider areas like the Veterans Administration are run by the public sector, and by public, I mean the government. Our healthcare is ultimately funded by us, the patients, but in a circuitous manner. Some of us pay for private healthcare insurance, a significant portion of which may be funded by our employers on our behalf. But over half of the nation's healthcare spend is funded by the taxes we pay in the form of Medicare and Medicaid and other government programs. And still other patients have no healthcare insurance at all. They must pay, therefore, by their own out-of-pocket expenditures. Or they simply can't afford to pay, in which case the healthcare provider doesn't receive any payment for their services. And even those of us with some form of private or public healthcare insurance usually pay for a large amount of our own healthcare visits by way of deductibles, co-payments, and or co-insurance. Confused yet? If so, you're not alone. Our healthcare business environment is complex. Who gets paid for healthcare services? How much do they get paid? When do they get paid? By whom do they get paid? These all should be simple questions to answer, and they are in just about any other industry, but not the healthcare industry. And when complexity exists in any business, those that are most prepared will be the ones that thrive. Today, we'll be discussing some of the current dynamics that are affecting our already complex healthcare system and why possessing strong business skills is more important than ever to navigate today's healthcare environment. Joining me today is Britt Berrett, who, along with Jimmy Markham, our communications director at the UT Dallas Jindal School of Management, co-founded the Business of Healthcare podcast. Britt and Jimmy founded this podcast to highlight the importance of strong business skills to compete and succeed in the U.S. healthcare industry. Britt is currently the managing director and teaching professor of the Healthcare Industry Collaborative at Brigham Young University. Prior to BYU, Britt was a clinical professor here at the University of Texas at Dallas, where he founded our healthcare management undergraduate program. Prior to joining academia, Britt held senior leadership positions at several health systems, including president of Texas Health Presbyterian Hospital, Dallas, executive vice president of Texas Health Resources, and president and chief executive officer of Medical City and Medical City Children's Hospital in Dallas. And if that wasn't enough, Britt is also a New York Times and Wall Street Journal best-selling author of Patients Come Second, Leading Change by Changing How You Lead. Britt, thank you for being with us today, and please start by telling us a little about what you're doing at BYU these days.
Well, thank you. And it's great to be with you. It's hard to believe that we're in our, 121st episode on this, of this podcast. And I hope those that jump on this podcast get hooked, because there's so much complexity in healthcare. I mean, it is so complex that it requires a discipline and a focus. That's what I'm doing here at BYU. We're preparing the next generation of healthcare leaders. And because of that complexity, it's imperative that leaders have a foundational understanding of the business dynamics. I've said it before, the clinical side is magnificent. The things that we can do, amazing clinical approaches to very difficult medical conditions. But the business side, it's broken. It's cobbled together for a number of reasons. And hopefully this podcast illuminates, shines a light on some of these business processes so that we can rectify them. So here at BYU, I'm doing much of what I did at UTD and hopefully have a national voice on this topic and this conversation.
So when you talk about the complexity, what specifically are you seeing in the industry post-COVID? Has anything changed, maybe because of COVID or just because of the delay sort of that COVID put into the system? What are you seeing on the other side of COVID?
Yeah, Dan, that's a great question. I think we could agree that during COVID, we had to tap the brakes. There were a number of initiatives that we had to put on hold because immediately we had to flip. We had to move from come to my clinic office and sit in a waiting room with all these sick patients, and I'll get to you when I get to you, to telemedicine and predictive analytics and disease and population health management. And so I think what you've seen as a result of COVID is an acceleration in business integration, also a greater awareness by the community on the importance of healthcare. I mean, let's admit it. I mean, when I was a hospital president for 25 years, and my kids barely knew what I did. I mean, they knew Dad was at the hospital, but you talk to your friends, they're like, "Oh yeah, we're in a hospital." You'd ask them, "Where's the hospital?" They had no idea. COVID pointed to the importance of healthcare and how it can shut down an economy, shut down a country. And so I think we have heightened awareness of the importance of healthcare professionals, and that not just superheroes wear capes, right? You've heard that. It is, speaking to nurses and clinicians, they say, not only superheroes wear capes, but you're seeing the non-clinical folks really stepping up to superhero status. We've got to look at, the revenue cycle. We've got to look at the supply chain. We've got to look at how we communicate with our patients and measure and monitor. And other industries are doing it magnificently. Healthcare has to learn those business processes for healthcare.
So one of the things we're seeing is, and you mentioned it, integrations, which you say integration, that can mean that's pretty broad, but we're seeing it in a broad fashion. We're seeing consolidations. We're seeing acquisitions. We're seeing, with providers buying other providers. We're seeing the advent of the payvider, where we've got large payers that are significantly getting into the provider space. I mean, you look at Optum as a division of United Health Group. Optum, I believe, has more physicians than any other entity in the country right now, either employed or under some form of contract with them. So you've got a big payer that's got a huge provider unit as well. And we're seeing physicians and physician groups joining other providers as employees rather than staying as independent groups. So what are you seeing there?
Yeah, I think that's the big one. I think the doctor component is the biggest element. Because there was a time you go to medical school, you come out of medical school and you hang a shingle up and you say, "Hey, everybody, I'm an OBGYN." Now those days are gone. If you want to practice medicine, you got to join a group. And now those groups are saying, well, we're not only a group, but we're part of THR, or we're a group part of Baylor Scott and White or HCA. So you're seeing this, I know they hate this term, but it is this mergers and acquisitions. It's a corporatization of healthcare. I mean, I honestly don't believe you'll see very many private practicing physicians in the future. There'll be an integrated delivery system, and we will use predictive analytics to determine the most effective and efficient and trustworthy treatment protocols. You'll be diagnosed with something, a disease, and they immediately will have access to reams of information on symptoms and treatment protocols. So I think physicians are going to consolidate into integrated delivery systems, and we're going to use those integrated delivery systems to manage a patient through their entire continuum of care. And I see that right on the horizon. You see artificial intelligence helping us make decisions on treatment, but also scheduling, symptoms. I mean, tracking patients. that's just but one indicator that this is a new dawn. This is a new day for healthcare, like never seen before.
And you talk about these providers, these physicians joining bigger organizations, corporate organizations. If you're a physician, you better start learning how to deal with that business environment, the business of healthcare.
Yeah, you'll get eaten alive. UTD's got a program, an executive education program, which is an MS in healthcare leadership for physicians, exclusively for physicians. And that has been going on for quite a few years. And the beauty of that is it takes a physician and says, hey, you're brilliant neurologist, but there's the business side of neurology that you really need to understand. So let's explain to you how strategic thinking goes through in a business, and maybe the revenue cycle, how you bill, and maybe electronic medical record. And doctors are smart, but this is not their area of expertise. And if they try and wing it, they will collapse. And so, the UTD program is exceptional. If there's a physician listening to this podcast and they're going, oh, I got it figured out. I don't think you do. I think it's a skill set that's so complicated. You need not only some education, but you need a cohort group of friends. And that's what they do. They have a cohort group of about 60 physician leaders across the United States, and they train them on the education of business. I did a 2-day seminar for American College of Healthcare Executives on physician leadership and physician business acumen, and it was oversold every time I did it. It's really an important area for our industry.
So we're talking about clinicians needing business knowledge. What comes to my mind first is the private equity plays that's so prevalent today. We've got private equity coming in and purchasing anesthesiologist groups or oral surgery practices, and basically turning them into business machines, holding docs accountable for patient volume and cash flow, using metrics and metric-based management techniques to squeeze synergies out of these practices and consolidate them and turn a bigger profit. And you talk about clinicians needing business experience. That's where the heart of it is.
And what you also see is the business world assuming healthcare is like any other industry. They go, oh, well, I've done retail. I've done, food services. That's applicable in healthcare. Here we go. And Walmart's a perfect example of how they jumped in and went, whoa, 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 we're jumping out. So I think if you have a clinical team with a partner that has business acumen, that's a winning proposition. If you try and force business processes into the healthcare space, you're doomed for failure. But you're right. The private equity companies are seeing so much inefficiency. They're jumping in, consolidating, rectifying, cleaning up old processes that we just keep on using, don't work, and they rectify those. I think you're going to see more and more of that, Dan. I think you're going to see more private equity coming in saying, let's fix this. I hate to say it, now that I'm an academic, I get calls all the time from people. A big area is biotech. Biotech is bridging some huge gaps in treatments. So they're using technology to diagnose illness. And then they're asking, okay, what's a treatment protocol that we can implement? And they're coming to me and saying, hey, help us understand the complexities of the U.S. healthcare delivery system. And sometimes their eyes start just going batty because it is really difficult to figure out.
Yeah, it's a maze, which again is why the business acumen is so important. Difficulties managing healthcare clinics like merchandise retailers,
right?
And that's what happened to Walmart. Figuring out selling prices, managing margins, being patient with startup losses. Those aren't things that these retailers are comfortable with. Walmart's primary care business model didn't work. I mean, a retail business like Walmart is measured by some sort of concept of revenue or margin per square foot. That's a primary care office. It doesn't fit that model. And so, like you mentioned, they're closing 51 of their health centers and virtual health services because they said they're not sustainable as business models, and there's a challenging reimbursement environment. So getting paid is tough in the healthcare business between payers and providers, and these These retail outfits like Walmart are in the learning process. So it's a learning lesson.
They won't leave us alone for long. It's $4 trillion, 20% of the GDP. It's estimated to move to $7 trillion. So it's not going away. But boy, they really took it on the chin thinking that it's just transactional. It's relational. Think about it for a sec. If I'm sitting in my home and I don't feel well, I'll go to a family practitioner. Family practitioner will receive, my $10 copay and then bill, $300. And then they have a negotiated discount to he or she'll get $150. Like, okay. But then that doctor is going to send me to a neurologist or a cardiologist or an orthopedic surgeon or a neurosurgeon, where all of a sudden there's that copay. But now we're talking about several $1,000s of physician engagement and diagnostic treatment and x-rays and MRIs. So that family practitioner generates a huge amount of economic interest, but we haven't figured out how to make that equitable. And that's why systems like THR and Baylor Scott and White go, well, listen, we'll just hire them all. We'll just hire them all. And then we'll figure out how to equitably distribute income to these doctors.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
You guys went to the Cleveland Clinic, didn't you?
Yeah, we took our honors program to the Cleveland Clinic to see how they do things.
Fascinating, I bet.
Yeah, exactly. I mean, these businesses like that, Cleveland Clinic, Mayo Clinic, the big nationwide or regional health systems, obviously they've been in this business for a long time and they've got to figure it out. Yeah. How do you survive in an industry where you have static reimbursement rates or static, revenue, or very slowly growing revenue, while at the same time you've got rising very quickly operating costs. Your operating costs are going up quickly and your reimbursement or your payment is not going up as quickly. How do you survive? And I think that's one of the things that, the Walmarts and the Walgreens and the Amazons, they're learning, and it's going to take some time. They're going to have some failures, but like you said, they're not going away. They're just recalibrating.
And for me, it's really important that as we introduce this discipline of business, we recognize that we're treating people that are sick. And the bioethical questions have to be asked and answered. It's not like, hey, listen, if you can afford extra food or extra, vehicle, if you can afford it, go for it. It kind of falls on its face when you talk about healthcare. I mean, are we going to get to a point where, hey, listen, the rich receive the care and the poor don't? And there is disparity in the access of healthcare across the United States. There's public health folks that talk about the discrepancies in average life expectancies by zip code. So you couple that with some of the things we've just talked about, it makes me want to crawl into the corner and sink into the fetal position and cry, or jump on a podcast and talk about it.
On that point, though, there's been significant advances which are helping us consumers as patients smarter. Devices like wearables and similar devices that are teaching us how to be better patients. But to your point, look at it by zip code. And it's easy for some to say, well, just get your smartwatch and it'll monitor your heart and you can, sync it with your phone and all that stuff. But, tell that to my 90-year-old mother who can't possibly, work that technology. So there is this discrepancy and it looks good. And we need these things to happen initially, these wearables and these other IT devices that are helping us. But in order to broadcast that, to disseminate that to the public, the larger public, that's going to take time.
I think there's a convergence of some big issues here. I think you've got, this silver tsunami the baby boomers that are moving into that 60 plus category. Let's admit it, in your 30s and 40s, you don't have a lot of healthcare issues, right? I mean, OB, GYN, maybe orthopedics. I mean, statistically speaking, it's when you hit your 60s and your 70s where healthcare really becomes part of the fabric of your experience. And to that end, we've got a huge number of the population that are moving in that space. Then you couple that with what you just described, our aversion or attraction to technology. And technology is opening doors we've never even imagined. Like you mentioned, the smartphone. I kid my students. I say, you got the smartphone. Guess what? Get ready for the smart toilet, where it will measure everything and determine if there's some anomalous excrement that they have to take. I mean, it sounds gross, but that's kind of where we're going to go.
Very eloquently put.
Thank you. And you got to ask yourself, that ain't cheap. So that technology and its infusion to healthcare is going to be really expensive. And then you add to that the technology outside that's being integrated into high-speed imaging. I mean, literally, there'll be a day when you get a full body scan as you walk through a doorway or a portal, and it'll look for any anomalous cell, which we would call cancer. A cell that mutates incorrectly, that's cancer. And then it replicates and duplicates and grows, and that's a tumor. Well, we'll have high-speed imaging, which will allow us to immediately identify it at its earliest stage, and then we'll be able to use pharmaceutical intervention to cause those mutating cells to basically become inert. Well, now you've seen this addition of new technology and new possibilities, really re-energizing and rethinking our healthcare delivery system. And that's what I think as healthcare future leaders, they're going to have to be problem solvers. I'm hopeful that there's an Elon Musk out there who's going to help us revolutionize some things with very creative and very forward-thinking healthcare treatment protocols.
Yep, and you layer business on top of that. And there's a lot of good ideas out there, but those good ideas and the technology may work, or maybe in the incubation process where it's going to work at some point. But you guys that are developing these things, you need the business plan, the plan to attract the dollars to help you continue, the investment dollars. You need to have business savvy to create those plans. How are you going to make money on this thing? How are you going to turn those dollars of investment into profit? So there's got to be a way to attract consumers, patients to this thing. And of course, you're going to have equity issues there, because the first place a business plan would probably go would be to a large population. Those large populations are in places where there's already a decent access to healthcare, but there's more people that are out there in the not so concentrated population areas that need this stuff as well. So think about, if you're in this kind of business, think about how you're going to reach those people as well, because there's a lot of consumers out there that'll be buying this thing if you can get it to them.
Right now, if you ask me, what's my medical history? I can't remember, right? Those days are going to go away. The cell phone is changing how we interact. And it wouldn't surprise me if you owned all your medical records and you were the owner of it, not your insurance company, not your provider, but you, and you had that information and you use that information to live your life. I'll tell you, it's a group to really watch is Kaiser Permanente.
Yeah. Kaiser
Permanente has gathered reams of data on populations, and they're now looking for partners. Geisinger and the rest, they're looking for partners, and they're very proactive. I think healthcare leaders of the future have to ask themselves, okay, who are some of these innovators, and what are they doing, and why are they doing, and where are the gaps that possibly could create opportunity for business folk?
Well, Britt, we've covered a lot of ground today. It's a dynamic environment. Thank you for spending some time with us and on this Business of Healthcare podcast, which you know so well, and sharing your thoughts about the importance of business acumen and leadership in today's healthcare environment. We wish you success in your work at BYU, and we'll continue to follow you with interest in your academic and business pursuits.
I can't thank you enough. Let me, if I might, leave one last bit of advice for those that are listening to this podcast. I think you need to be purpose-driven. I think healthcare leaders need to recognize that, and for me, it's a divine appointment to bless the lives of patients we serve. And we have amazing clinicians doing amazing things. We have amazing business people who can participate in the delivery of care. And here at BYU, we say we're transforming healthcare. We're transforming it. And for me, it's through Christ-like attributes, with hope and faith and kindness and courage. And we can really look at the delivery of care for those that are in desperate need. So it's great to be here at the BYU. I open it up. If anyone would like to reach out, would be thrilled to visit with you. We've got a couple of programs and classes. I can't speak highly enough of what's going on at UTD. There are 5 or 6 programs, both undergraduate and graduate level, executive education, that if you're a serious student in this space, you'd be well served in taking some classes at the University of Texas at Dallas. So, Professor Karnuta, it's a pleasure to be with you. Thanks for the invitation. It's been great being with you.
Thanks for coming. Thanks for listening to the Business of Healthcare podcast. To learn more about the Center for Healthcare Leadership and Management and the healthcare management business degrees and certificates available to seasoned clinicians, master students, and undergrads through the University of Texas at Dallas, go to jindal.utdallas.edu/healthcare.